All right, good morning, everyone. Welcome back to Eldercare's weekly webinar series. I am Adrienne Ostritz. I am super excited about today's topic. I know that we've done this topic before, but it's been a while, and there are some new things we're going to talk about, and we are super excited because anytime you mention innovative Plan G, agents are like, what is that? I thought a Plan G was a Plan G. Like, what is an innovative Plan G? So we're going to get into that. But just a few housekeeping things. If this is your first time attending our live trainings, we want this to be a conversation. So please find the Q&A box. Tell us good morning. How are you doing? Like, what are we, day 3 of AEP? How are you staying above water? Let me know. And let me know what states you're in because he's going to go over where this is available. So please find that whether you're on Facebook Live or on Zoom. Let us know. You can hear us, see us. If you've ever sold Physicians Mutual, if you've never heard of Physicians Mutual, we want to know where you're at on this topic. But without further ado, I'd love to introduce our special guest. Good morning, Robert. Welcome.
Good morning. Yeah, I'm so excited to be on this webinar with everyone. My name is Robert Davis. I'm with Physicians Mutual. I'm the National Sales Director. I work hand in hand with my partner, Justin Rodriguez. So if you have been contracted with Physicians Mutual, you've probably gotten some emails from him, from me, and we're so excited about this AEP. We understood walking into this AEP, this was going to be one of the busiest, but also busy is a good thing, right? We understand the disruption in the industry is going to give us all more opportunity. And so in today's call, I just want to talk a little bit about Physicians Mutual because I would tell you that we are a disruptor in the industry. We have products and incentives that you're not going to see anywhere else. Like Adrienne said, the two main focuses will be number one, the innovative G, and then I'll take a little bit of time and talk about our Preventive Benefits Plus rider, which is another benefit that you don't see anywhere else in the industry.
Right. You
So
don't
like,
see riders on Medicare supplements very often.
yeah, you usually don't.
No, not at
You
all.
usually don't. And one of the big things that we all think about in the Medicare supplement world is that all Medicare supplements are the same, right? Like Adrienne said, a G is a G is a G, but not at Physicians Mutual. And we totally believe that what makes us different makes us better. And so here's a product map of the United States. Everywhere you see the black tic tac, which is all over the place on this map now, it's crazy, is the new Physician Select block. So if you're in a state where you see the black tic tac, both things that I'm talking about today apply to you. Two updates to this map. I know we got a couple of California agents, part of the Eldercare team. California just got the new block, and also Indiana just got the new block. So those are new additions, but definitely if you want this is something that we can email out to you. I can give it to Adrienne, anyone that needs the product availability, because I know so many agents work nationwide. And so you'll need this.
And thank you for being a carrier who shows this at the beginning of the training. So I know all the agents, that's what they're always anxious to see. And so you have people from Arkansas. Blanca is on here from California.
Yeah.
You got Jack with Texas, Rami. Good morning, everyone. So you have folks on here that are, this applies to them. So they're taking notes.
Cool.
And yeah, we're super excited. Thank you for sharing the map first off.
Yeah. So let's get into it. So usually the way we discuss the innovative G is it's truly a patented Medicare supplement. So it's something that's exclusive to Physicians Mutual. We've been selling this product since 2008. And if you are taking notes, here's what I would write down. The innovative G has a disappearing deductible with a lifetime discount. Let me say that again. It's got a disappearing deductible with a lifetime discount. Why is that important? Well, we see the innovative G have a 60% higher persistency rate than a standard G in the marketplace. Why? Because the client is getting Plan G benefits for their lifetime at a discounted rate. So lower premiums for life for your clients that you care about. It also does two things. When I think innovative, it's good for the client, lower premiums for life. It's also good for you. If you think about it, we all say this, a G's a G is a G.
Mhm.
It's hard sometimes to stand out in a crowded marketplace. And the innovative G will allow you to do that. Because there are clients I know sitting down in the field with clients. I'd sit down with some people and they knew nothing. And then you sit down with some people and they have their research, right? And they're like, tell me about a G and tell me what the rate is for your G that you're offering. The innovative gives you that topic that can really make the client lean in, which is always what we're looking for. So we say we have a patented product, we say it's an innovative G. How does it work? And so I would really encourage you. I know if you're on this call, you probably know Medicare supplements. I get that. But I would encourage you to follow me because there's so much on this screen and I get that. Follow me just for a moment. So let's go over to a plan G. So a plan G, you pay nothing when you go to the hospital, right? See the zero right there. But with a plan G, you do have a Part B deductible. So this is an annual deductible of $240. Here's one thing I always say. Not only is it an annual deductible, it's also a max out of pocket, if you think about it, right? Because after you meet that, you pay nothing for the rest of the year. And then let's flip over to a high deductible G plan. So a high deductible G, again, there are some agents I work with, and this is a main part of their portfolio. They see value in the high deductible G. And then there are some agents that have never looked at it before. And so this is important. So if the client were to go to the hospital, okay, they would pay $1,632 for 60 days of service. Okay, this covers 60 days of service in the hospital. About 1% of people will actually go to the hospital in their first 2 years on Medicare. Okay, so a very small percentage of people have that risk. And then we have the Part B deductible. We've seen this number, right? It's the same as the Plan G. It's $240. And this is where it starts to get really important. Once you meet this annual deductible, Medicare kicks in a co-insurance. So Medicare pays 80%, the client pays 20% with a max out of pocket of $2,800. What is interesting is to understand how many people in their first 2 years on a Medicare supplement will hit a max out of pocket if they have a high deductible G plan. The number, 4%. That means 96% of people never reach the max out of pocket. And I'll tell you the why here in a moment. Part of it is because the co-insurance, right? Medicare is picking up 80% of the bill. But we'll talk a little bit about the why here in a moment. It has to do with Medicare billing. But then we get into this innovative G. So again, this is exclusive to Physicians Mutual. The way it's going to work just like a high deductible G for the year you purchase. So this example, the rest of 2024, 2 more calendar years. And then January 1st of 2027, what happens? Well, this innovative G turns into a plan G, but the premium does not increase. And so the difference in pricing between a plan G and an innovative G is usually anywhere between $20 to $30. So what you're doing is you're locking in a 20 to 30% savings for that client for their lifetime. Okay. So let's talk a little bit more about this. So again, what percentage, because one of the things that scares people initially is that max out of pocket of $2,800. And I said, only 4% of people will ever hit that. Why? So this is the why. We've probably all gone to Medicare.gov, but I would encourage you later today, go to Medicare.gov and look up the procedure price lookup. Okay. Because we understand that Medicare has specific prices that they charge when it comes to going to doctors. Okay. Let me give you a couple of examples. A chest x-ray. You know how much a chest x-ray costs? If me or you go to the doctor right now and we get a chest x-ray, we're probably spending $400, $500. What's the Medicare approved amount? $17. What about an MRI? So if you go to the procedure price lookup and look up an MRI, let's say on your knee, again, if me or you go, depending on our insurance, we're spending $400, $500, $1,000 for that MRI. What's the Medicare approved amount? $37. Diagnostic blood work, actually $0. So you start to understand why only 4% of people are ever going to hit that max out of pocket. Now, we understand that so many clients turning 65, or even some of our clients that are 75 or 72, they're currently healthy. And what this plan does is allows them to take advantage of their health right now to lock in long-term benefits. Because we all know that as we get older, we all have clients that as they starting to get into their 80s, maybe their 90s, their health is going to decline. And here's the thing. Would you rather have your client on a plan G when they're 90 or on a plan that has a max out of pocket when they're 90, like a Medicare Advantage plan? I want to help my clients have the best coverage possible as they get older, okay? At the lowest rate possible. And that's what this does. So probably the most confusing part, and I wish we could make this not confusing, probably the most confusing part of the Innovative G is understanding that there is an elimination time frame, right? There's a deductible time frame before the plan G kicks in fully. And so for some agents, this is a really good picture to help them understand this. Usually the phrase I usually use, it's the year they purchased the product plus 2 calendar years. The year they purchased the product plus 2 calendar years. But here's what I would encourage you. If you sit down with a client later this week and they want to underwrite into a Medicare supplement that offers them lower premiums with better benefits, they have the rest of this year, which is 3 months plus 2 years. November, 2 months and 2 years. December, 1 month, 2 years. The worst case scenario is a January birthday, right? Because you got a full 3 years here. But again, the Innovative G allows them to have lower premiums for life. And here's the thing, maybe you're not sold yet. And I get that. This is a new concept. And I would encourage you, I plan on, if you want me to, if you want to put your email in the chat, I have a short 10-minute video about the Innovative G that I created, where you just hear this material a second time. Because sometimes it takes 2 attempts to really just, it clicks. But if you're not sold yet, look at this slide with me. Let's say you're sitting down with twins, right? You got Anne and you got Dorothy. Anne and Dorothy, right? They're twins, so they're the same age, right? And so they're both turning 65. And so you have Anne right here that says, you know what? I really like that Innovative G concept. I'm going to buy the Innovative G. It's priced at $94. Dorothy, a little bit more conservative, a little concerned about the elimination time frame. She goes 130. She goes a full plan G. We get that there's an annual difference there. There's a difference in coverage day one, right? But what happens when these two sisters turn 68? Well, at 68, they both have the same plan, right? They both have the same plan. But now there's $523 in savings just that year for Anne choosing the Innovative. And by the time these twins are 80, Anne, the one that chose the Innovative G, has saved over $11,000. Now, let me point this out. Does the Innovative G take rate increases? Yes. Does the Plan G take rate increase? Yeah. So both will take a rate increase. What you're doing is you're getting the G benefits at a discounted rate for life. And that's something that's really critical. I'm going to try something here. And really, I'm not. I was about to say, I'm going to stop sharing for a moment and then I'm going to start sharing. I'm not going to do that. Let's just talk for a second. Okay. Who's the best candidate for an Innovative G? Because I think when it comes to a new plan, a new concept for an agent, you're like, who do I sell this to? Right? Because you want to position this to the right client. And so let me give you 3 options. So number 1, someone that's healthy. And when I say healthy, I'm not talking about a marathon runner. I'm talking about someone that doesn't have multiple illnesses where they're having to go to the doctor every other week. Okay. They're not they're not, they're someone that can qualify usually for an underwritten Medicare supplement. Okay. So if they're healthy, why is this the right candidate? Because you're allowing them to take advantage of their health right now to lock in a discounted rate. And I always get this pushback, and there's probably someone in the chat just getting ready to ask me this question, right? Well, what happens a year from now if they get diagnosed with cancer? If they become critically ill during the elimination time frame. What then? Have I made a mistake? No. The great thing is anytime during the elimination time frame, if they want to convert up to the full G, they can do so without answering health questions. So they can always move up. So what you're doing with the innovative G, and again, this is what clients are looking for, especially Medicare clients. Part of the reason why someone chooses a Medicare supplement is they want choice and they want freedom. Mm-hmm. That's what you're giving them truly with the innovative G. So number one, if they're healthy, position the innovative G. Number two, I don't know if you know this, 3 out of 4 Americans currently have a high deductible plan. And when we think high deductible, again, what we're talking about is a max out-of-pocket plan, right? 3 out of 4 Americans have a high deductible. And what's usually the average high deductible amount currently in America? It's right around $7,000. I sit down with clients, sometimes their max out-of-pocket's $5,000. I sit down with clients and their max out-of-pocket's $10,000. And so if the client is already used to an annual deductible, a co-insurance, and a max out-of-pocket of $10,000, and you can position a product that has a max out-of-pocket of $2,800, and in less than right over 2 years, it's down to $240. There's a massive value proposition there. So hopefully all of us, and I'm sure Adrian has hosted plenty of calls talking about fact finding, right? We need to find out what their current deductible, their current max out of pocket, because that's going to help you understand if positioning the innovative G works. Mm-hmm. So again, someone that's healthy, someone that currently has a high deductible plan, someone with an HSA, and this goes back to fact finding. If you're not asking about HSAs, do that, because that is a slam dunk for the innovative G. The average amount in an HSA is about $6,000. And so a health savings account, right? Mm-hmm. What can they do with a health savings account? What they can't do is they can't use the HSA on premiums, but they can use the HSA on coinsurance and deductibles. And so if they have $6,000 in HSA, even the worst case scenario of hitting the max out of pocket 2 years in a row, which wouldn't happen, is covered. Okay. So the innovative G is great for healthy people. It's great for people that currently have a high deductible, and it's great for people with an HSA. So I would encourage you over the next week to put this into your routine of positioning this product and positioning Physicians Mutual. Along with that, we also have a 2-year selection guarantee, and you're not going to see this with any other carrier. Again, what makes us different makes us better. Within the first 2 years of owning our policy, you can switch up or down in coverage without any underwriting. Now, if you have the innovative G, you get the whole elimination time frame to do that. But if you bought, let's say, a high deductible, here's the thing. If you bought a high deductible with Physicians Mutual, in 6 months, if your health changes, you can switch them up to a full G. You buy a client buys a high deductible plan with Mutual Omaha, and 6 months from now, they get diagnosed with cancer. What does the client have to do to get a full G? Go through underwriting, which they'll fail. Okay. So this is a really cool benefit. Deaf research tells us the number one concern for a client when it comes to picking a Medicare supplement is making the wrong decision, which goes back to choice and freedom. And then finally, I think I told Adrian, I was like, I'm just going to talk about the innovative G today. And then right before, I was like, you know what? I'm going to talk about it a little bit more. And I got 10 minutes, so I think I can get through this.
You got it.
Okay, so this is the Preventive Benefits Plus rider. In many states, it's a rider that you can add on for $9.53. I know we got some Texas agents on the line. It's built into the price here in Texas. It's built into the price in Wisconsin. And if you're South Carolina, anyone selling in South Carolina, for some reason, South Carolina's got to be special. They're $9.51. Okay.
Nice.
Yeah. So, but it's $9.53. You get these two benefits. So first is preventive care. Here's the thing. It fills in the gaps when it comes to preventive benefits. There's no dollar limit on this. It's defined as an innovative benefit. Most carriers don't go beyond standard benefits. So again, that goes back to a G is a G is a G, because there's standard benefits they all have to offer. We go above and beyond with this benefit, and it's unique to Physicians Mutual. So I want to talk a little bit more about that here in a second, because I think that's a game changer, is the preventive care. But Silver and Fit just has a special place in my heart because I've been selling med subs for 12 years. And I remember one of the first appointments I had, the client said, I don't know if I want a Medicare supplement or a Medicare Advantage. She started leaning towards a Medicare supplement all the way to the point of I was filling out the application 12 years ago. And as I'm filling out the application, you know what she asked? Does this come with a gym membership? And I was young and dumb 12 years ago. I said, do you even go to the gym? I stopped saying that because that was bad. But here's the thing. We have a gym membership in our Medicare supplement. So we have access to over 15,000 gyms at no cost with Silver and Fit. So when you think about gyms, if you're driving through your city and let's say you live in Little Rock, you're going to see a Gold's Gym, right? You're going to see probably a Planet Fitness. You might see an LA Fitness. All those are in the standard network. Now, if you're someone that really likes to work out, you go to like Orange Theory, which I think I did that once and I never went back. If you go to Orange Theory, we will discount the price at Orange Theory. We'll discount the price at some of the different Pilates, even UFC. I don't know why that's in network, but UFC is one of those premium fitness centers that you can get a discount at. Daily classes, home free kits. So your client will get a gift every year because they have this benefit. Things like Garmin's, Fitbit, a strength training kit with weights, really cool stuff. But this is where I just want to really probably wrap up the call on, is this screen right here. So talked about preventive benefit and it being an unlimited dollar amount. It's an unlimited dollar amount. Why? What is preventive? Well, there are certain things where if your client goes to the doctor and the doctor codes it preventive, did you know Medicare will deny the claim? One of them, which again, I always get some pushback on, is a true annual physical. But you can Google it when we get done. Don't Google it right now. After we get done, does Medicare cover a true annual physical? The answer is no. And it's interesting and kind of like mind-boggling, right? Because usually throughout our working career, if you have insurance, what do they want you to go get every year? Mm-hmm. They want you to go get an annual physical. But under Medicare, it's not paid for. So our clients can go get an annual physical. The doctor can code it preventive, which is the right way to code it. Mm-hmm. They will send it to Medicare. What will Medicare do? They'll deny it. And then because of Medicare crossover, where does it go next? It goes to Physicians Mutual. Mm-hmm. We will pay 100% of that bill, which can average anywhere between $360 to $960. Okay. Anywhere between $360 and $960. That is a value per month of $30 to $80. The next one is Lifeline screenings. I don't know if you all know anything about Lifeline. I would encourage you to talk to your clients about it because it's shocking to me when I start talking to clients, they're familiar with Lifeline screenings. Mm-hmm. Lifeline screenings are great because unlike a colonoscopy, like you don't get poked, you don't get prodded. It's really simple. It takes about 20 minutes and you don't have to take your clothes off. It's great. And it's early detection for everything under the sun, including stroke and heart attack. Now, I'm not going to share it today, but if you're interested, I have a letter from a client to their agent. You know what the letter says? Thank you for number one, the preventive, but thank you for telling me about Lifeline. This client went and got a Lifeline screening. It was going to be paid for by Physicians Mutual. Medicare wouldn't have paid for it, but we will. He went and got one. He found out he had an aneurysm in his belly that could have burst at any moment and killed him. And so getting that Lifeline literally saved his life. Next is thermography. Thermography is for early detection of breast cancer. And so another important one, and cancer is something that's almost affected everyone we know. And the more we can do to catch things like cancer early, the better. A CBC full blood panel. But you have all of these, and there's more we could talk about. Another interesting thing is, even with a colonoscopy, did you know that Medicare will only pay for it if you do it every 5 years? Like my father-in-law, he has some friends that have died from cancer. Him and his doctor decided to do it every 3 years. As soon as he got on a Medicare, he did his normal every 3-year colonoscopy, and they sent him a bill for $1,600 for that test because it wasn't approved by Medicare. So it wasn't the Medicare approved amount. He had to pay the full amount. Right?
Yeah.
Because it didn't fall on the Medicare schedule. But here's the thing. This is a great slide. I can share this with Adrienne. She can share it with everyone. But you don't have to sell the preventive benefit with dollars and cents because it's so much more than that.
Mm-hmm.
If you look at someone, you ask them after maybe sharing some information about this, and you ask them this really simple question: what's the purpose of going and getting preventive tests and scans done? Like, why? Why do you do that? And they're probably quickly going to look at you kind of like, why don't you know this, Robert? It's for early detection. Well, why does early detection matter? Well, early detection matters because it extends my life expectancy, which gives me more time with the people I care about. And also with things like stroke, a better quality of life if I were to have a stroke or a heart attack. So preventive care is truly priceless. And if you can walk the client through that concept, not only are they intrigued with Physicians Mutual, because this is an exclusive benefit to us, but that preventive benefit plus that $9.53 is amazing value. And then you get a gym membership on top, right? A gym membership on top. So I got a few more slides, but I'm going to send all the slides to Adrienne. She can share those with you. Because if I'm not careful, I'm just going to keep talking for another 30 minutes like I did at the Eldercare event, which was bad because I took away all of Allstate's time. But it was funny. Afterwards, he was mad, but he did ask me, can my mom, who lives in Missouri, get a Physicians Mutual Medicare supplement? So that was cool.
Yeah.
That was cool. So any questions? I'm horrible at looking at the chat while I'm going over this, but Adrienne, any questions from the chat that, or we can open it up for questions right now?
Not yet. No. I mean, we have some agents that are sharing their emails, want the presentation, want the training videos, but no specific questions yet. I don't know what your other slides are, but I'll have questions for sure.
Okay, well, let's get into that because I think I kind of summed up a lot of the last couple of slides right there. So that way we'd have some time for questions to wrap up today's call.
Okay. And agents, I know sometimes there's a lag in the question submitting. So if you do have questions, put them in there. Any questions you might have at all about the product, about MedSups, about anything, whatever you feel like might be stopping you from offering the product. I mean, put it in the question box. Let's get it answered right away, and we'll give it a second for it to come through. But I always have questions about marketing materials. I always have questions about like the e-apps, like how easy is it to actually write the application? I mean, do you have the materials that I can just print and send to people turning 65? Because, you know, Eldercare does offer free turning 65 data. So what do you have that I can send to that?
Yeah. So we have a specific, so number one, I would say the best place for any agent to go is physiciansmutual.com.
Okay.
At the top of physiciansmutual.com, it says agent and broker platform. There they can access a marketing site, and we can share this with you also, that has anything and everything under the sun when it comes to brochures, when it comes to marketing material. Also on the agent and broker platform is where you're going to find the e-app. And I will tell you, we have come a long way in the past year. And so I know there are some agents in Eldercare that have maybe had written us in the past.
Mm-hmm.
And I'll be completely transparent, we were clunky. But unlike other insurance companies, we made massive changes quickly. And so our e-app, I believe, is one of the easiest to use. We have multiple signature options, which include texting, which includes DocuSign, which includes a type of technology called IVR, which is a voice signature, which is probably the easiest way to sign an application. And along with our Medicare supplement, we're in the season of AEP. And one of the things to maximize your compensation and your persistency as agents is cross sells. And our dental is the best dental plan on the market, mainly because every other dental plan on the market has an annual max and ours does not. So we have no annual max on our dental, which really allows it to stand out along with the largest network in the nation. We have about 600,000 different providers in network, and it is a PPO, so you can use it in network and out of network. But one more thing on the Medicare supplement. With AEP, we're all going to be sitting down with people. And I would encourage you that when you sit down with a client, you're doing some underwriting or when you're doing some fact finding, if they have a Medicare supplement, let's find out the price. Let's find out what extra benefits they're getting from it. And if you can save them money and get them better benefits with Physicians Mutual, we are also one of the easiest companies to underwrite with. One of the easiest companies to underwrite with, which is important during AEP. And right now we have some massive incentives when it comes to underwritten Medicare supplements and also innovative Medicare supplements. We will pay you more than any other carrier.
Awesome. So I'm assuming like after this call, we'll get all the material for, are they per app bonuses and
Yeah, so they're per app bonuses. So right now we're paying $300 for underwritten Medicare supplements, whether it's an underwritten innovative or underwritten G. And then if it's open enrollment, we have probably the highest open enrollment MedSup bonus because most carriers are doing about $50 for open enrollment. We're doing 200 open enrollment innovative G.
Wow.
Yeah.
That's impressive.
Yeah.
I hope everyone is still listening to that. We did have a question. So Felicia, I believe, she got the contract for the dental product, which is awesome. But that would include the Medicare supplement too, right? It's the same contract for both.
Yeah. So yeah, if you have a contract with Physicians Mutual, you have access to our full product portfolio.
Great question. And then Shirley had asked, if someone has a MedSup now and they do have medical conditions, like what would be the process for them to see if they qualify or would pass underwriting for?
Yeah. So I think it's important. Here's the thing. We want to do the best thing for our client, which means always going to bat for them. I think here's the thing. If the client says they have conditions, I'm more open to underwriting them. Sometimes you have a client that's like, I'm so healthy. Like those are the clients where like you actually start filling out like the underwriting questions and you're like, no, you're not. Or that you find out they take 20 medications. And then the idea is if I take 20 medications, then I don't have those problems. It's like, yeah, that's why you're taking the medications. But a couple things on underwriting. So I would line up our underwriting questions very similar to many of the big carriers, United Healthcare, Mutual Ma. We have very similar questions. What is a little bit different about us is we have limited underwriting if the client is between the age of 66 to 68. The limited underwriting questions really fall into a few categories like cancer, hospital stay in the past 12 to 24 months based on the state, diabetes with insulin, and then you have the HIV question. But if they can answer no to that, we're not going to ask about medications at those younger ages. So it's a great opportunity. But we have, every single week I see apps submitted for clients between the age of 75 to 85. And every single week I see them getting issued.
Okay.
So I would encourage you to work with us. We can send you the underwriting questions. That way you can go through and see what the knockouts are. But it's a great season to save people money and get them more benefits.
Yes, it is. Absolutely. This year is definitely very disruptive. I'm sure everyone has heard that word multiple times. A lot of agents and clients are looking at more Medicare supplements. I'm going to be very interested to see the market after this AEP, if it's getting closer to 50-50 or which way is it leaning, MedSup or MA?
Yeah.
But this is definitely something you need to be aware of, because if you're not educating your clients on the innovative plan G, another agent will. And that's the big thing is why we do these trainings, is so you're aware of everything that you have access to and that's in the market, because clients can know everything that's in the market too. So it's your responsibility to be educating them and providing all the options to them.
Yeah.
We do have people asking for the incentives for the underwriting questions. Absolutely, we're going to get that to you. And I'm going to, those of you who shared your emails, I'll make sure that Robert gets those and he reaches out with that video he did. I'd be interested to see it too, because it did take me, I think, 3 webinars for that light bulb moment for the innovative G. But I think that your first chart with the breakdown of the Plan G versus the High G and then the
Mhm.
Innovative G, and then doing that wording of the max out of pocket analogy,
Mhm. Yeah,
technically,
yeah,
definitely helped me have my light bulb moment. Hopefully it helped all of you agents have that as well. And if
yeah,
you do need further help, Eldercare and Robert with Physicians, we're here to help you any way that we can.
yeah. The last thing, so two final things. You brought up marketing, which I know is a big deal.
Mhm.
We not only can help you during AEP, but the great thing in the Medicare supplement market is this is a year-round sport, right? People are turning 65 every single day throughout the year. And if you're interested in really leaning in on the Medicare supplement market, we can help with Medicare one-on-one seminars when it comes to actually paying for the marketing to go out to invite people in. If you're interested in working with some of your local libraries or community centers, really definitely we can set up a call individually to talk about it. But
Wow.
it's really just setting up the date, time, and location, giving me that information 4 weeks ahead of time. I'll send out the material, the marketing pieces. I'll run the data, I'll send out the marketing pieces, and you just show up. We have agents in small markets that are getting 15 to 16 attendees and closing about 70% of the people that walk in the door. And again, it's more of a year-round model than it is specifically AEP. But if you wanted to start it, late November and run it through next year, we can definitely assist with that. But as Adrian was saying, this is a disruptive time. And there's always different companies that are disruptors, right? And what's interesting about that is I think we all need to be hesitant for new companies coming into the industry. Um, there's always new companies coming in the industry that sometimes offer crazy good rates, and then they don't last very long in the industry. What's great about Physicians Mutual is not only are we a disruptor when it comes to the way we look at our products and the benefits, but we're also a company that's been here a long time, a company that has A+ ratings, a company that's been in the industry since Medicare started, and a company that when your client calls, here's the thing. I was an agent. I still consider myself an agent. You know what I always told clients? Call me. Don't call the company. Call me. You know why half the time we say that is we're worried about them calling the company and having a negative experience. Because when they call the company, where are they calling? They're calling somewhere halfway across the world. Um, Everything we do is US based. Our customer service department has a 95% customer service. So not only are you putting them in a great product, but you're putting them with a great company that will help you retain your clients, which is so critical, so
Mhm.
critical moving forward.
Yes, absolutely. I love that so much. Thank you for sharing that. We just have more people sharing their emails. I don't see any further questions coming through. Did you have anything else you wanted to close on? Is this the last slide?
Yeah, this is the last slide. We will wrap it up right here. Adrian, thank you so much. Everyone, thank you so much for jumping on today. Please do not hesitate to give me or Justin Rodriguez a call. I think one of the most important things right now that we can offer you is our availability through AEP and just with your business. So that's what we want to offer is our
Yeah, and
availability to help you.
I'll say something to that. I called you last Friday asking you a dental question
Yeah,
for an agent and you were on it. There was no hesitation. So we definitely appreciate carriers that answer their phone when we need them. So thank you for
yeah. I don't know if you heard my 3-year-old in the back seat when I was talking to you Friday night, but definitely, yeah, we will give you a call. There might be some kiddos. I got 4 little ones around, so you might hear some crying children sometime, but we'll give you a call back.
He's got the answer anyways.
Yeah,
Alrighty. Well, thank you everyone for taking the time to learn with us live this morning. Or if you're watching the recording, thank you so much for taking the time to learn about this product. And if you're interested, of course, in getting set up with it, please reach out to us here at Eldercare, comment, call. We're going to answer the phone and hope you have a great rest of your AEP.
awesome. Thanks, everybody.
Thank you, everyone. Bye.